Hey everyone, this is your host. Today we're going to talk about the 4 different symptoms of chronic obstructive pulmonary disorder, also known as COPD. If you're new here, make sure to subscribe so you don't miss any future videos. Now let's get into it. First, we have chronic bronchitis. This is when there's mucus and edema in the airways, making it difficult for air to get in. The patient will have dyspnea, or difficulty breathing, especially when exhaling. They'll have cyanosis, or a bluish tint to their skin due to low oxygen levels. Also, there will be a cough, often described as a hacking cough. In addition, there will be clubbing of their fingers. You can see it here. See how the tips of their fingers are rounded and their SA decrease in the angle of their nail beds? That's called clubbing. Also with chronic bronchitis, there will be pulmonary arterial vasoconstriction. This is because there is an increase in pulmonary artery pressure and that causes the blood vessels in the lungs to constrict. So the major symptoms of chronic bronchitis are mucus and edema in the airways, difficulty breathing, cyanosis, cough and clubbing of the fingers. We can remember this by thinking mucus, cough, cyanosis. Mucus and cough are both C's and cyanosis starts with AC, so does chronic bronchitis. Next we have emphysema. With emphysema, there's air trapping in the alveoli, or air sacs of the lungs. This makes it difficult for air to get out of the lungs. So the major symptom here is difficulty breathing, especially when exhaling. They will also have chronic hypercapnia. That's a buildup of carbon dioxide in the blood. And this will lead to a prolonged exhalation. So they will have a prolonged exhalation and a rapid, shallow inhalation. When we breathe, we should breathe in and breathe out at roughly the same rate. But with emphysema, they breathe in very quickly, but then they have a hard time breathing out. It's like blowing up a balloon and then not being able to blow the air back out. As the patient struggles to exhale, their diaphragm gets pushed downward, causing them to have a barrel-shaped chest. So the major symptoms of emphysema are air trapping in the alveoli, difficulty breathing, chronic hypercapnia and a prolonged exhalation. We can remember this by thinking air trapping, prolonged exhalation, barrel chest. Air trapping and barrel chest start with A and B. Prolonged exhalation has AP in front of it just like the word pink. And emphysema makes the patient look pink and puffy, so we can think of the nickname pink puffer. So the major difference between chronic bronchitis and emphysema is that with chronic bronchitis, there's inflammation and constriction of the airways, whereas with emphysema, there's damage to the alveoli. Both conditions can lead to the formation of COPD. Thank you for watching and I'll see you next time. Bye.